Um, so like you said, we have 2 weeks, basically this week and next week, and then it's the end of the 9 week. So next week, next Friday is the last day of this 9 week. And then we'll start the third 9 weeks of the school year. Um, so like I told y'all before, before we left, we still have one more major grade. I can't remember how many minor grades. It might be one or two. To close out this 9 week. Um, so I've already figured out what that is. It's gonna be a test. We're gonna do notes, for the next few days, and then let y'all test next week. So I have a study guide here that I made already. You can grab a copy. It is on Schoology. I haven't published it yet, but if you want to do it on Schoology, that's on you. If you want to get both, that's on you. But there is a paper copy here, so that's up to you what you would like to do. It really doesn't matter to me as long as you do one of them because it's going to be a grade. So we're gonna be talking about communication. That is what the topic is going to be for this last little bit. Um, Makeup work, which I'm trying to get everybody to complete makeup work before we left. I'm still putting in grades of people, that did makeup work or, that did turn some stuff in. Um, so I'll be doing that over the course of this week, next week, if you missed something or if you turn something in late or whatever. And I think first 9 weeks, grade recovery. I need to look in the grade book. I don't remember. Is anybody in here that is fake? I think the couple people that did fake completed it. I can't really remember right now, but I'll look. So if you know you got makeup work, proceed to work on it. Only thing with the makeup work for like a 9 weeks that's passed. Power School is not like I now in the sense that we can go in, they can open it up for us, and we can go in and change stuff. With Power School, we have to submit paperwork like a work order for them to open it, and we have to have it submitted by I think it's noon on Thursday. So I think by noon on Thursday, I have to submit like a copy of the progress report with the grade, the F that you made, and then another piece of paper that has to be signed by the principal. They're opening it up for 24 hours, and then it'll close on Friday. So I only have that window for each week to put in grades. So it's not like I can just put in grades whenever I want to. Not how it works with private school. So if you know you got makeup work, you make sure you get it in so that I can submit it so that when it opens, and it doesn't open unless you put in it, like it doesn't just open. It doesn't open for everybody. They only open like for that class. So I got 3 foundation classes. If I don't put nothing in for y'all, it's not gonna open for y'all. It'll only open in if I do like my first period. It's gonna only open that class. So that's why, like, if you got work, make sure you get it turned in so I can go ahead and submit the paperwork so that I can change your grade. So that's the difference between that and how we use I now with like grade change and all that stuff. All right, so these are just questions that I came up with to see what y'all know about communication. I mean, everybody knows how to communicate at some point. Y'all are in high school, and y'all are trying to learn ways to be more effective in your communication skills. So, who has a definition? What is your definition of communication? What does communication mean to you? Anybody? Y'all talk all the time, so y'all know how to communicate. Nobody? Okay,
I say Miss Karen, I say my definition of communication is expressing thoughts.
Expressing thoughts. That's correct. That's the way to communicate. Expressing how you feel, what you're thinking. So what are some ways that people communicate with each other?
Hand gestures.
Huh?
Hand gestures.
Hand gestures. What else? Verbally, expressions. So you can do it verbally, you can do it non-verbally. What's another way y'all can communicate?
What is it now?
Another way. I said non-verbally, but what about not really technology when I'm getting like written, like emails, communicating through emails.
Technology.
Or you can write a note. That ain't technology.
But you can do it.
Typing,
Yeah.
typing, or writing, written. I was trying to get y'all to say written. That's what I was trying to get. So written, nonverbal facial expressions, like they said, hand gestures, stuff like that. What form of communication you think is used most? Verbal. Right. Who do healthcare professionals have to communicate with?
With each other.
Each other, patients, or who else? Superiors, family members, other facilities. If they got to transfer a patient or get a patient, they communicate with many different people. How do healthcare professionals use written communication? What kind of things do they write or chart?
Like notes,
Prescriptions, discharge papers, diagnosis. Yes. So even though we've moved into the world of more technology, now a lot of things like charting is done, through technology. It's done like in a system. But me personally, when I worked at a hospital, even though we charted in the computer, or actually that's where the patient's information is gonna be. I had a piece of paper, just a white piece of paper, and I'll write down my it's kind of like a report sheet. Write down my patients on it. Probably some way to print out one, but I just like write mine so I know what I want on my because it was my stuff. But you keep up with that paper for my whole shift. Write down. I might write down patient's vital signs when I had to go do something important that might have happened throughout my shift. I worked at night, so something important. Because think about it, when you are a healthcare worker, you have to give report to the oncoming shift. So if it was something important, I might need to jot it down so I can let them know, hey, this patient in room whatever does this or has this or whatever. They might be going for early surgery, or they might have to do something. They might not be in their room, stuff. So I would write that down. And then they gave me a way to chart when you have to chart in the computer. Because sometimes technology don't work all the time. Y'all know this. Y'all know Chromebooks don't be working and the Wi-Fi be down. So sometimes it's the same thing in the hospital. Might go into a room, and most now they have like a lot of them have like little bedside computers in the room where you can chart while you're in the room. Sometimes they don't work. So if I got that paper, I can just when I get time. And then sometimes you don't have time to chart right then. Especially if it's like something going on or emergency happens. So I could have it written down and then I could chart it later. All right. So we're gonna talk about communication. And y'all be careful. I know it's like a broken record, but still in the middle of a pandemic. Omicron, which is a new variant to COVID, which is more easier transmitted, easier to catch. People are catching it left and right. I know a couple of my students got it currently. Some people that got it currently. So just be careful. Continue to wear your mask, hand washing, whatever, distancing yourself, whatever you need to do. Although, we do have a vaccination that's out, just because you're vaccinated does not mean that you cannot get COVID. You can. That's with anything. It's just supposed to lessen the severity of it, lessen the symptoms and stuff like that. So just be careful, because I don't, like to see anybody sick. So. All right, so today we're going to talk about basic communication.
After you finish the
All right, so our objectives for today are to define communication and its role in the healthcare industry, distinguish among verbal, written, nonverbal communication, and then understand and use therapeutic communication guidelines.
Oh, I know you. I guess you will.
All right. All right, so communication is a process of exchanging messages. So that's what the definition of communication is. A few other professions require the level and range of communication skills that the healthcare industry does. In this atmosphere, accurate communication is vital. Um, Healthcare professionals must communicate effectively and appropriately with other healthcare workers, patients, and clients, and their families, students, visitors, administrators, and business contacts. The greater responsibility for communication rests with the healthcare worker. Communication exists in many forms, so you got verbal, written, and nonverbal. All right, so which of the following is the best definition of communication? Process of exchanging messages. With whom must healthcare workers learn to effectively communicate? All of the above. So that's coworkers, patients, clients, students, um, visitors, administrators, and business contacts. So all those people, and probably more, they communicate with it.
Verbal communication.
All right, so you have verbal communication. It's the use of language and words to send and receive information. Verbal communication can take place face to face or over the telephone. It can also occur one to one or in a group. So you can be like, one on one talking to your boss or your coworker, or it can be like a staff meeting, or it could be like a team of doctors talking to like a patient and their family member or whatever. Um, Verbal communication is the form people use most often. It's the most effective. It allows for instant feedback and discussion. So as opposed to like written communication. Like if you're standing there talking to somebody, you can get like a whole discussion going on, instant feedback. Y'all can go back and forth, whatever. With like written, like if it's in an email or something like that, you have to wait for somebody to respond. Um, it can end confusion instantly and bring about clarity and understanding. The goals for verbal communication in the healthcare environment can typically be put into one of the following categories. You can establish rapport or a connection. You can obtain information from patients. You can confirm understanding, relate information to other healthcare workers, and give instructions to patients. All right, so on Monday morning, greets her first patient, Tim, by asking if he had a nice weekend. Saria is using which of the following goals of verbal communication? Who? D. Right, establish rapport or a connection. So she just kind of talking to him, getting, no, just don't just barge in and just like, I gotta do blah 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 blah. At least say good morning, how you doing, whatever. Why is verbal communication often the most effective way to communicate? A, it allows for instant feedback, clarity, and understanding. Right.
Tone of voice.
All right, so it's been said many times, it's not what you say, but how you say it. This saying refers to tone of voice. A speaker's feelings are expressed through tone of voice. A healthcare worker's tone is very revealing to a patient. Patients can easily pick up on fear, agitation, calmness, and confidence from the healthcare worker's volume, rate, and pitch. Healthcare workers must be aware of how they sound. If they can adjust their tone of voice appropriately to the situation, it can become an effective communication tool. They can use their tone to calm and reassure patients even if the news is bad.
Language.
With all the medical terminology that healthcare workers are required to know, they practically speak a different language. They need that language when conversing with colleagues. However, when interacting with patients, they must translate the medical terminology into lay terms. Lay terms are everyday language that patients can understand. For example, instead of saying lumbar, you will say lower back. Instead of saying prostate, you will say ribs. At the same time, healthcare workers must avoid talking down to patients by oversimplifying their language. They should also avoid making noises such as and which are meaningless. Finally, they should be careful to enunciate words and avoid mumbling. The result is healthcare workers that sound professional and knowledgeable. That professionalism builds patient confidence in healthcare workers. And medical, like healthcare workers, healthcare has their own language. Like it's words for everything, some long words, it's acronyms, it's abbreviations for things. And people in healthcare industry tend to talk in those abbreviations or talk in those acronyms, which I'm guilty of it too. Sometimes I have to remember that y'all probably don't know what I'm talking about, so I have to think of the lay terms for it. When I first started here, it was really bad because that's all I knew how to talk was I'll say something to like one of my coworkers and I'll use like an acronym and they're like, what? So then I had to remember, okay, I'm not at the hospital. So I had to, even though sometimes it's longer to say what the word is, I have to remember to say what the word is because they're not going to know what I'm talking about. So, but as a healthcare provider, healthcare worker, you have to know when to use the right terms uh, for your patients because some of them might not understand. People that go to the hospital often or have been dealing with something, they probably will know, but especially if it's new to them, you got to kind of break it down for them so that they understand what you're talking about. Even though you might say the word, you still might need to say the lifetime so they can start making a connection of what that really means. Like most people, you don't hear people saying your prostate, but that's your ribs, and they'll say your lower back, even though lumbar is the correct term for it. In verbal communication, how is emotion expressed?
Tone of voice.
Tone of voice. That's gonna write that down. What can a healthcare worker do to ensure that a patient understands medical information? You know, use appropriate lifetime. You write that down. All right, so we're gonna look at different scenarios of communication. So we'll just answer them out loud. Y'all have to write them down. All right, so Michelle works as a medical assistant at a general practitioner's office. Mr. James is Michelle's current patient. Mr. James' last visit was for extreme pain in his lower back. He is now visiting the office for cold symptoms.
Good morning, Mr. James. I'm Michelle, and I'll be talking with you briefly before the doctor comes in to see you.
Hi, Michelle.
So let's see. Oh, it says here that the doctor diagnosed you with acute lumbar myositis.
The doctor didn't tell me I had that.
I bet that changes how you do things in your daily life.
I don't understand. All he said was that I had strained my back.
All right, how was the patient's reaction when he heard he had lumbar myositis?
He was
He
thrilled.
was confused.
Somebody say thrilled. He was confused by the medical terminology. He didn't know what it was because the doctor just told him he had, pain in his lower back, or probably inflammation, because this is what all this the suffix means. And we know from the other slide that lumbar is lower back. What could Michelle have done differently while communicating with her patient?
Use lay terms.
Your finger's broken? It's all right on here. Thank you. Use lay times.
It's too early in the morning.
Girl, whatever. I had 2 weeks.
Good morning, Mr. James. I'm Michelle, and I'll be talking with you briefly before the doctor comes in to see you.
Hi, Michelle.
So let's see. Okay, I see the last time you were in the office you had some back pain.
Oh, yes, I had a lot of pain.
How's your back feeling now?
My back's much better. I'm much more careful now when I'm working in the yard. Don't want to go through that again. Now, if I could just get rid of this cold.
Okay, in scenario 2, Michelle used terminology the patient understood. And then how did the patient's reaction differ from in scenario 2 than from scenario 1? What was the difference between his reaction? He understood what she was talking about. So he understood because she said back pain instead of lumbar or myositis or whatever it's called. So
Therapeutic communication.
all right, so you have something called therapeutic communication. Patients communicate through both verbal and nonverbal communication. Therapeutic communication is patient-centered communication in which the patient is looked at as a person. Therapeutic communication results in improved patient satisfaction as well as improved health outcomes. As a result, quality patient care depends on excellent therapeutic communication skills. When communicating with patients, it's important to remember your scope of practice. Any questions you ask a patient must fall within the scope of permitted questions and boundaries of your field. So, like, it depends on what your actual job is. Like, if you're an LPN, you're a X-ray technician, you're a nurse, you can answer questions that's in your scope. If it's outside of your scope, then you need to refer them to whoever that will fall under. Okay, so just make sure what your scope of practice is, what you should. If you have a degree in it, you have a license, certification, all those things, then you know what falls under your scope of practice.
Therapeutic communication.
So when communicating with patients, follow these therapeutic communication guidelines. You develop a rapport or positive relationship with the patient. To develop a rapport, act and speak in a calm, competent, and comforting manner. You should speak clearly and slowly. You'll introduce yourself to the patient at the start of the conversation. You'll ask the patient what he or she wishes to be called and refer to the patient in this way. You'll use language the patient can understand, avoid medical jargon, codes, and abbreviations. For example, do not ask what is your chief complaint, instead ask what's wrong. Show leadership, but do not be imposing or give advice. Be honest with the patient, do not provide false assurance.
Therapeutic communication guide.
Alright, so you should use open-ended questions. An open-ended question requires more than a 1 or 2 word answer. As a result, answers to open-ended questions are descriptive and revealing. Examples of open-ended questions are what happened and how do you feel. Do not ask why questions. So you ask them what happened, they're going to give you more than like a yes or no. That's an open-ended question. How do you feel? It should be more than just like a fine. Because if they're there to get some kind of treatment, you need to know what's going on with them. Even though people like to not tell you what's going on. Use closed questions only when specific information is needed. A closed or direct question requires a simple 1 or 2 word answer, often yes or no. Examples of closed questions are you having difficulty breathing, and when did you last eat something? Be sure that the question does not lead the patient to an answer. For example, do not ask, do you have chest pain? Instead ask, do you have pain anywhere? You don't want them to just be like, yes. You want them to say, where do you have pain? And they can actually tell you where they actually feel pain. Ask the patient one question at a time. Don't interrupt them. Allow them enough time to answer a question before you go on to the next one. You should listen carefully to what they have to say. Acknowledge what they're saying with their response like, I'm listening, I see, and go on. If necessary, take notes so you do not forget information.
Therapeutic communication guide.
You should let them ask questions. Allow the patient to discuss his or her concerns and feelings. Be empathetic by looking at the patient as a person and acknowledging his or her concerns and feelings. Not focus only on the patient's illness or injury, but also how the illness or injury affects the patient. Ask the patient for permission before performing a procedure. Tell the patient what you're going to do. Apologize for any necessary discomfort and pain. Be aware of your nonverbal communication. So you can't just be like, oh, it's not gonna hurt, or because you don't know. People have different responses to pain and painful stimuli and stuff like that. So you should always ask them, hey, I'm here to whatever. Like if you're drawing blood, is that okay if I draw blood? Tell them what you're doing. Tell them it's gonna be. I always just say this is gonna be a big stick because it was. So you can't be like, oh, it's not gonna hurt or it's gonna hurt you because everybody's different, so you never know. Can't just tell them how it's gonna be. It might be different for them. When should an open-ended question be used?
Open-ended question.
Got all the above. I got A.
Yeah,
Alright, to obtain descriptive and revealing information. Which is an open-ended question?
B.
Alright, what has been your experience with the care of our staff provides?
Written communication.
Alright, so written communication is a form of verbal communication. Depending on the situation, there are benefits to using written communication. It allows a writer time to research and to organize thoughts. Additionally, once written communication is completed, it can be proofread and edited before it reaches its audience. Written communication must be accurate and clear, and it should be brief with logical organization. It should be free of grammar, spelling, and punctuation errors. Finally, written communication should include vocabulary that is appropriate for the reader. Healthcare workers use written communication for the following: messages and orders, test results, notes and patient's charts, informed consent documents, procedures and policies, patient education materials, surveys, letters, and memos. So these are all ways that, as a healthcare worker or healthcare provider, you can use written communication.
Select
Alright, so before using written communication, healthcare workers must first ask themselves if the message would be better delivered orally. They should also decide whether or not the message requires a written record. Once it has been determined that written communication is necessary, healthcare workers must decide which which format the message should take. The written message could be a letter, email, report, etc. Memos are typically used for internal communication. Internal communication occurs within an organization, such as between a physician and a nurse. So, physician is a doctor. Letters are often used for external communication. External communication includes items that are sent outside of the agency, such as to an insurance company or to the community. Which of the following is a benefit of written communication over oral communication? It can be researched and edited. Alright, because remember, verbal provides immediate feedback, so you're having a whole conversation. When selecting the best form of communication, what should be considered? Nobody?
writing memos. Memos are
Alright, so memos are a form of written communication. They are used often in the healthcare industry, both in printed form and through electronic mail or email. Memos have some standard parts. So you have your to part. This part should include the names of all the people for whom the memo is intended. From, this part should include the name of the person sending the memo. Date should contain the date the memo is created. Subject, this part should briefly state the purpose of the memo, and body of the memo follow these parts and includes the details of the message. So these are all parts of writing a memo.
the 5 double.
Alright, once a format has been determined for written communication, healthcare workers must write the message using the 5 W's. So you have, who is the audience, what is the purpose of the message, why is the message important, when did or will the event occur, where did or will the event take place. Which of the following is one of the 5 W's? Alright, what's the purpose, why is it important, who's the audience, when did or will it occur?
Nonverbal communication.
Alright, so nonverbal communication includes methods used in addition to or as a substitute for language. Nonverbal communication includes the following: eye contact, facial expressions, gestures, and body language, physical appearance, touch, and proximity. Which of the following is a method of nonverbal communication? All of it. So you got touch, proximity, physical appearance, facial expressions, all of the above.
Eye contact and facial expression.
Alright, so eye contact is one form of facial expression. Direct eye contact usually sends a powerful and positive message. Smiles also generally communicate a positive message. However, an artificial smile can often be detected by others. Other facial expressions communicate as well. A blank stare can indicate fever. A grimace can express pain. A bland look can suggest depression. Healthcare workers must be conscious of both interpreting facial expressions in others and in mastering their own expression to be sure that they are sending the appropriate message. Healthcare workers should strive for an open, friendly expression that is neither too solemn nor too cheerful.
Je-
What can the tapping of a foot imply? Crossing the arms, waving. In addition to facial expressions, people can communicate through body language and gestures. Body language sends powerful messages to others. At times, people can use their bodies instead of words, such as when someone nods or shakes the head. Posture also conveys a message. People who stand up straight exude confidence, while people who slouch appear unsure of themselves. Healthcare workers must be skilled both in reading and in gestures and body language effectively. They should be sure to lean forward slightly when interacting with patients. This body language shows interest in the patient. Describe the facial expression that a healthcare worker should strive for. Right, so you got not too solemn, open, not too cheerful, friendly, and so it's all of them. Healthcare workers should lean back and away from patients to appear interested in the conversation.
Physical appearance.
In the healthcare industry, many workers wear uniforms. Their uniforms send a message that they belong to the healthcare field. Um, yeah, it's back here where all the stuff is plugged in. Some patients take comfort from the image of someone in uniform, while others are intimidated or frightened by it. Healthcare workers must be aware of these opposing views and be sensitive to how they interact with patients based on how their appearance is received. Like some kids, little kids, if they see somebody, not necessarily in scrubs, but they come in with the lab coat on, they might get scared because they think, they're gonna get a shot or something like that. So I know sometimes, like when you work in a setting with kids, they'll take some stuff off as not to alarm, them if something's about to happen. So sometimes they'll do that. In addition to uniforms, physical appearance is also expressed by grooming. Someone who is well groomed communicates a positive message. Someone that is disheveled and not properly groomed can send a negative message. Piercings, facial hair, and overdone makeup can negatively communicate to others. So, when I worked at a hospital, it wasn't really an issue. I don't think facial hair was, but like if we had tattoos that were visible, we had to make sure that they, were covered up. So we either had to wear sleeves, like a actual sleeve, or scrubs have like, they're short sleeves, so or you just have to wear. I was used to. I always wore just like a long because and first of all, if you've ever been in a hospital, you know it's freezing in the hospital. Especially at night when I worked because it wasn't a whole lot of movement going around. Once probably about 9 o'clock when visiting hours started in and people started going home, it wasn't a whole lot of movement going on. So it was free. It was really freezing. But I always wore like a long sleeve shirt under my scrubs just to cover up, tattoos or whatever. So and people, wear sleeves. You'll be surprised how many tattoos people that work in the hospital have. Like some people will be like, oh, everywhere. But, that's one thing they made us do was cover up our, tattoos or whatever. Not, I don't want nobody coming to my room with all this makeup looking like a clown. You want to keep it to a minimum. I mean, you're going to work, so why would you You want to work at a hospital. Why would you want all that stuff on your face anyway? So, some stuff we had to do just to appear more professional, um, and, give a more positive, uh, I think piercing, like facial piercings. I don't remember anybody really. Maybe a nose ring, but it was like, it was like it wouldn't be like no bullhorn or no a bull loop or whatever they're calling, no big old. Yeah, it wasn't like that. So I can't remember. But I mean, you can easily cover that up with like a mask. We didn't have to wear a mask like we do now, like they do now, but people would wear a mask, probably to cover that up if they wanted to.
touch,
Touching patients is required in many areas of the healthcare field. Touch can communicate many things. Touch can also be misinterpreted, which can be a serious matter. Special licensing that is required for healthcare workers provides them with some protection against some misinterpretations. However, healthcare workers must always be conscientious to touch patients with only kindness and respect. Patients can easily detect an inappropriate or uncaring touch. Communication in touch can also be expressed in how quickly and comfortably healthcare worker moves with the patient. So sometimes touch is required as a healthcare worker. You don't ever want to touch a patient inappropriately. Nowadays, because of they got allegations stuff out about healthcare workers. You got the doctor that was part of the women's gymnastics team that was molesting some of those gymnasts or whatever over amount of years. But like normally now, if it's anything that you gotta like undress for, or like if you have a male doctor and you're female, they should bring a female, like a nurse or somebody in the room, you know, to make sure nothing is going on. So, but you shouldn't touch anybody inappropriately. Sometimes healthcare workers abuse patients, not just touching them inappropriately, but they'll abuse them. So it's only so much like you can be protected by, but if you're like abusing a patient, touching them inappropriately, then I mean you'll possibly lose your license and your job or whatever. Beyond clinical touching that is required, healthcare workers may also feel inclined to give patients reassuring touches in appropriate context. In some cases, a kind, concerned hand on the patient's shoulder can communicate far more than words can.
proximity. Proximity refers to the physical.
All right, so proximity means to like the physical space between people. The distance between people is one aspect of proximity. The appropriate distance between people varies among cultures. Healthcare workers must often invade patients' personal space in order to perform their duties. Sensitivity, professionalism are required when patient proximity is an issue. So sometimes, depending on what you got to do, you have to get a little closer to the patient. You know, some cultures they don't, deal with people being real close up on them or whatever. Um, but sometimes it calls for it, depending on what kind of procedure you got to do, or what you're giving them, whatever. Proximity can also be communicated through height. In communication between two people, if one is standing and one is sitting, the person who is standing communicates authority over the other person. In the healthcare industry, there are many cases where a healthcare worker will stand over a patient who is seated or lying down. Healthcare workers must be sensitive to how their proximity affects patients. Healthcare workers should sit down as often as possible when communicating with a patient. So, you might have had to deal with a healthcare worker that's pulled off a chair. It's more not like domineering, because if they're standing over you, but if they sit down, get kind of eye level, it's sometimes a little bit better. So sometimes people will do that so it doesn't seem so intimidating. For one, you're somewhere and you gotta talk to somebody about whatever, your health or whatever. So that's one thing that they teach. Because everybody doesn't have like good communication skills. Even some doctors, they can't communicate. Some nurses can't communicate. It's a very important part of being in the healthcare field, but some of them just can't get it together. So, and then it's just there. Some people just don't have it. So, and they try to teach you stuff like that, but sometimes it don't work. As long as healthcare workers are wearing appropriate uniforms, they need not pay attention to personal grooming and hygiene. Healthcare workers must always be conscientious to touch patients with kindness and respect. Which of the following refers to the physical space between people? Proximity. Alright, so what goes under verbal?
Tone of voice. Oral communication. Appropriate vocabulary.
Verbal?
Language, non-verbal. But, physical appearance.
Goes under
Non-verbal.
Facial expression, non-verbal.
Touch is non-verbal. Non-verbal.
who?
Proximity, non-verbal. Written communication is verbal.
Alright, so your verbal, you have tone of voice, oral communication, appropriate vocabulary for reader, and then written communication. Your nonverbal, you have your body language, your physical appearance, your facial expressions, touch, and proximity.
Lesson summary. In this lesson, after you finish the tone of language, written communication.
You need to know that written communication involves informed consent.
physical touch, proximity.
Alright, write this down. Healthcare workers should sit down as often as possible when communicating with patients. Alright, you should have answers to some of your if you need a study out, you can get one from here.